Welcome to another episode of Med Madness, where we break down complex medical topics into clear, concise, and digestible content for aspiring healthcare professionals. Today, we're diving into the topic of hirsutism in women, a condition characterized by excessive hair growth in areas where men typically grow hair, such as the face, chest, and back. We'll explore the various causes, clinical features, and how to differentiate between them. By the end of this episode, you'll have a solid understanding of the underlying mechanisms of hirsutism and its clinical implications. Next, let's discuss the causes of hirsutism in women. Hirsutism can result from a variety of underlying conditions. The most common cause is Polycystic Ovary Syndrome, or PCOS, which is characterized by irregular menstrual periods, elevated levels of male hormones, and obesity. Women with PCOS often experience other metabolic complications, such as type 2 diabetes, dyslipidemia, and hypertension. The gradual nature of hirsutism in PCOS typically develops over several years, with symptoms like acne, male pattern hair growth, and menstrual irregularities. Another important cause of hirsutism is idiopathic hirsutism. Unlike PCOS, idiopathic hirsutism occurs in women with normal menstrual cycles and normal serum androgen levels. The exact cause of idiopathic hirsutism is unclear, but it is thought to be related to increased sensitivity of hair follicles to androgens. Next, we have Nonclassic 21-hydroxylase deficiency, a less common cause of hirsutism. This genetic condition leads to an enzyme deficiency that causes symptoms similar to those of PCOS, including hyperandrogenism and menstrual irregularities. However, a key diagnostic marker for this condition is elevated serum 17-hydroxyprogesterone levels. Androgen-secreting ovarian tumors and ovarian hypertrichosis are more concerning causes of hirsutism, especially in postmenopausal women. These conditions are often associated with rapidly progressing hirsutism and signs of virilization, such as deepening of the voice, male pattern baldness, increased muscle mass, and clitoromegaly. These symptoms indicate significantly elevated androgen levels, which should prompt an evaluation for ovarian and adrenal sources of androgen production. Cushing syndrome is another condition to consider. It is characterized by obesity, particularly in the face, neck, trunk, and abdomen, increased libido, virilization, and irregular menses. The excess cortisol in Cushing syndrome can lead to a variety of metabolic disturbances, including hirsutism. Now, let's consider a real-life case. A 30-year-old woman with a history of well-controlled PCOS, managed with combined estrogen-progestin oral contraceptives, presents with new-onset abnormal uterine bleeding and rapidly progressing hirsutism. Over the past few months, she has noticed deepening of her voice and increased facial hair growth. These symptoms are atypical for PCOS, especially given her previous stable management. Her clinical presentation raises concern for an androgen-secreting tumor, such as a Sertoli-Leydig cell tumor. This type of ovarian tumor secretes high levels of testosterone, leading to the virilization seen in this patient. Prompt evaluation and management are crucial in cases like this to address the underlying tumor and prevent further complications. To summarize, hirsutism in women can result from a variety of conditions, ranging from common endocrine disorders like PCOS to more serious conditions like androgen-secreting tumors. Understanding the differences in clinical presentation and associated symptoms is key to identifying the underlying cause. Thank you for tuning in to this episode of Med Madness. Don't forget to check out our pre- and post-podcast quizzes and Anki flashcards to reinforce what you've learned today. Engaging with these tools will help solidify your understanding and prepare you for your exams. Until next time, keep studying, stay curious, and continue your journey in medicine with confidence.